Mr. Secretary, let's start with an easy one. Do you have a medical or public health degree?
No.
No?
No.
Yet you're overruling doctors, scientists, and public health experts across our country. Your dangerous conspiracy theories are undermining safe and effective vaccines. Mr. Secretary, I want to echo my friend, the ranking member's comments about polio. I remember as a kid, kids older than me in school with me who got polio. They live with the lasting impacts of that infection for the rest of their lives. I was fortunate to get the polio vaccine, and I was fortunate to never get polio because of that vaccine. And because we're about the same age, I'm sure you have similar experiences. But now you undermine vaccines and are helping make diseases deadly again. Mr. Chairman, I ask unanimous consent to submit for the record this article from the Sacramento Bee about the rising measles cases in California.
Without objection.
Thank you. In 2000, measles were declared eliminated in the United States. And I've got a graph behind me that shows that. Under 4 years of President Biden, there were 514 measles cases in the U.S. Under just 1 year of President Trump, there are nearly 2,300 cases. Mr. Secretary, kids have died because measles is running rampant under your watch, in large part because President Trump allowed your conspiracy theories to run our public health. Americans need serious leadership grounded in evidence and science. Instead, we have you and this president elevating misinformation and undermining basic public health. HHS should be led by professionals who respect science and data, listen to doctors, and put patients first, not by rhetoric, not by conspiracy, and not by ignoring established medical facts. So today, Mr. Secretary, this is not just about policy differences. It's about whether this department is going to protect the health of the American people or put them at greater risk. Right now, it looks like the latter. Let's not sugarcoat this. Americans are paying more for health care, not less. Families are being squeezed at every turn, and instead of relief, they're being handed policies that will make things much worse. You and this administration promised to lower costs. Instead, costs are rising. And you and this administration ripped health care away from millions of people. H.R. 1, the big, ugly, big, beautiful bill, whatever it's being called these days, cut $1 trillion from Medicaid. That means fewer doctor visits, delayed care, and more people showing up in already overcrowded emergency rooms. Let's be honest where this leads. People will get sicker, preventable conditions will go untreated, and people will die. Mr. Secretary, you shouldn't be in this office. I yield back the balance of my time.
Mr. Schweikert.
Mr. Secretary, you are actually the first person I've had in my 16 years who's actually willing to have conversations with me on how to have the revolution of lowering the costs of health care and help our brothers and sisters be healthy. But I want to go to one that makes the lobbyist community pucker up because every other lobbyist seems to be working on this. These are just some of the MedPAC reports. You pay for them. They basically say Medicare Advantage, Medicare Part C, has a misalignment on the math. We need to come to a final conclusion. Are these accurate? Or the stories I get from the lobbyists accurate? Are the insurance companies accurate? Because the latest report says Medicare Advantage comes in at 114% of fee-for-service. In 2005, when we set up Medicare Advantage, which I'm a big supporter of, a capitated model where you make your profit by helping your brothers and sisters be healthier instead of a model where you make your money by constantly risk scoring them as sicker. And you saw last year's Wall Street Journal series showing how many people had been scored as being sick and they didn't have that disease. They had never been tested for that disease. 114% compared to 95% fee-for-service, is about $1.75 trillion over 10 years, making it the single biggest misalignment in the federal government. Can I beg of you, and I know you're going to, Dr. Oz and others, we need to put everyone in a room, maybe our actuaries, maybe my economists from the Joint Economic Committee who've been working on this for 3 years. It's a stunning amount of money. How do we use Medicare Advantage, a managed care model, to have your vision of they make a profit because you helped people be healthier? It may require a multiple year enrollment, so there's a payoff for the investment. 31% of Medicare spending is diabetes. What can I do to work with you? What can I do to move CMS and HHS to a vision here of healthcare for seniors?
Thank you, Congressman. I'd love to have those discussions with you. I'll say the fraud, a part of it is perverse incentives, as you pointed out, and part of it is fraud. Medicare Advantage was created as to end perverse incentives to give us value-based care, as opposed to traditional Medicare. And in some ways, it's doing that. In every metric that we look at, people who have Medicare Advantage are better off. They're healthier, they're getting treated better, they're more compliant. And people who are getting cost or fee-for-cost programs. One of the other problems is that one of the major problems is upcoding. And it's just rampant fraud throughout the system, as you point out, and we are fixing that now for the first time. And I can tell you that we're already seeing some change in the discrepancy. This year, we raised the premiums for, or we're proposing to raise the premiums for Medicare Advantage by 2%, whereas Medicaid and Medicare are going up by 5%.
Mr. Secretary, I want to propose a more radical solution of alignment of incentives. Get rid of the risk scoring. I would get rid of the star rating and do those scoring at the beginning, and then design a system where as you help the enrollee get healthier, they benefit. We're almost out of time. I want to thank you and the agency for also starting the things of wearables, the thing you wear in your wrist, the thing you wear, and the ability to allow Americans to sort of have their own medical lab attached to them. Now we have to figure out how to allow it to prescribe. And with that, I yield back to Mr. Chairman.